In fact, I'm here in this symposium in the workshop, hands-on workshop regarding cytogenetics. This is what I am talking about, and this is because in the last years several studies have shown that patients with complex karyotype, with a lot of abnormalities in the karyotype, perform poorer than those that do not present these abnormalities. So there are some needs to go through this issue and start analyzing more these cases with complex karyotype and trying to know if it's in real world it's true or not, and if there are any other biomarkers associated to complex karyotype. There are other biomarkers, important biomarkers, such as, for example, TP53, that is an important gene abnormalities, which can be deletions or mutations that are in some instances associated with karyotype complexity also. And there are other cell-intrinsic biomarkers, such as, for example, IGHV mutational status, that are also covered in other hands-on workshops here in this international meeting. There are other biomarkers, such as, for example, some immunological biomarkers, such as CD38 positive cases that perform poor than negative, or other like ZAP70. Now we are trying to find new biomarkers, for example, mutations, some mutations that are associated to poor prognosis. Some mutations appear when the patient is resistant to therapy, and it's important to detect these cases, because if you have a mutation that confers resistance to the treatment, it's important to know not to treat this patient with the wrong therapy. The idea is try to find a subgroup of patients that maybe are going to perform poorer, and try to define which is the best therapy for these patients, and not to treat them with a therapy that it's not gonna go well in these patients. So not treat patients with a wrong therapy. There are also cases having complex karyotype that perform well. So not all complex karyotype cases perform bad. And it's important to know that there is a subgroup of patients that would be classified as complex, but they will perform well. So it's important to know about this.